My name is Timothy J. Hardy. I'm with Atlantic GYN in Virginia Beach. I've been practicing in Virginia Beach for over 30 years. I'm here to talk about the bioidentical hormone. Estrogen and testosterone and progesterone has a lot of benefits in women who are menopausal and perimenopausal. So women who are going through the change of life, have had hot flashes, night sweats, vaginal dryness, decreased sex drive, hair loss, also atrophy of vaginal tissue and the sex-related tissue in the body, such as the breast, the hips, and skin also gets thin and more wrinkly. We've had a lot of women who have taken the bioidentical hormones, and it has made a big difference in their life. The biggest thing we've noticed is women have had less brain fog. So we had one lady who recently thought that she was losing her mind. She was not being able to carry on simple tasks that she would normally be able to do at work. And because she just couldn't think clearly enough, and once she started using the bioidentical hormone, she was amazed at how the brain fog resolved and went away. Well, the biggest concern is that in 2004, there was a big study sponsored by the United States government called the Women's Health Initiative. And that study suggested that estrogen caused breast cancer. And in fact, they stopped one arm of the study because the rates of breast cancer had exceeded the limit. And so they thought that the harm from breast cancer was too high to continue the study. 20 years later, we know that those hormones that were used in that study were synthetic hormones that had higher risk of breast cancer, higher risk of blood clots. Now, what we're using now is bioidentical hormone that has lower risk of breast cancer, lower risk of heart disease, they have lower risk of stroke, lower risk of blood clots on their legs. There was one study done in England that showed that women lived longer with hormone therapy, with bioidentical hormone therapy. So the bioidentical hormone therapy is estradiol, which is the exact same molecule that the body produces. So the synthetic are slightly different than the estradiol. One of them was derived from horse urine, and that was Premarin. And it was definitely not estradiol. The other hormone is prometrium, and prometrium is bioidentical progesterone. And the other hormone that is overlooked in the WHI study and previous study was the benefit of testosterone. Benefits of testosterone include more energy level, increased sex drive, increased sexual response with bioidentical testosterone. So this has been, the bioidentical hormone has been out since about 1956. Dr. Greenblatt was the one who championed the use of bioidentical hormone, but unfortunately, there was nobody that picked up the mantle to commercialize it because it's the exact hormone that the body produces, and so you can't patent a hormone that the body produces. You have to patent something that's a little bit different that you develop and that you create, and then you go before the FDA and get FDA approval, and that's how you can commercialize it. So because of that, there's been a lot of misinformation about the bioidentical hormone therapy. And some of the pharmaceutical industries have misled people into thinking that their product is safer. We didn't know in 2004 during the Women's Health Initiative that there's several different estrogen receptors. There's the alpha and the beta receptors, and even among the alpha and the beta receptors, there's some subtype receptors. Now that we know that the synthetic don't bind the same way that the bioidentical hormone binds to the receptors. Therefore, they have different results in the body. By and large, everyone has said that they feel like they have more energy, they have less hot flashes, less night sweats, they have improved sex drive and a sexual response. And of course, they feel closer to their partners. We've had some women say that it saved their marriage because they were drifting apart sexually and their intimacy was strained. And now that they're enjoying sexual activity more, that they're closer to their partner. A lot of people have some misinformation about testosterone. So women produce testosterone and men produce estrogen. There's just the relative amount. So women produce a lot of estrogen and a small amount of testosterone, and men it's the reverse. But both men and women produce estrogen and testosterone. When a woman goes through the menopause, her testosterone levels drop. And with the drop in testosterone, there's decreased energy, there's decreased sexual desire and sexual response, and there's also a decrease in muscle strength. Now, the downside to testosterone is that when you give testosterone in male levels, which is why we monitor the hormone levels, they can have an increase in hair growth, so facial hair. They can have deepening of their voice, and then they can have worsening of their cholesterol level. So the goal is not to get the hormone levels up to the male levels, but to get it closer to the female levels, which was the levels that they had before they went through the menopause. We monitor the lab levels to make sure that it's not too high and also not too low. And then once we get them into a steady state, then they come in every 4 months, they get the same thing. The benefits of the pellets are that there's not the ups and downs that you'd have with the pill or even with the patch, but the levels stay the same throughout the whole 4 months. And then you can just get a new pellet every 4 months. It's right below the skin. There's a small incision made. Usually it's in the hip region, and then they're inserted into the fat that's right below the skin on the hip. It's a minor procedure that takes 2 or 3 minutes, and it's done under a local anesthesia. The majority of the women that use the bioidentical hormone are women in their menopause. Occasionally we use it for women who are on the birth control pill because the birth control pill causes the testosterone levels to go down naturally in women in their 20s and 30s. There are case reports and studies that show that women who cannot tolerate another birth control benefit from additional testosterone to increase their sex drive and their sexual response, but maintain their birth control so that they don't have to worry about unwanted pregnancy. A woman in her 20s and 30s who have low sex drive, a lot of times on the birth control pill, just changing the type of contraceptive that a woman uses from the birth control pill to, say, the IUD will cause her decreased sex drive to resolve. Another use of testosterone that's controversial is in women who have had breast cancer. So there's studies that show that while estrogen and progesterone is not recommended in women who have breast cancer, especially estrogen responsive breast cancer or hormone responsive breast cancer, testosterone has been shown to antagonize cell growth in breast tissue. And therefore, testosterone use has been used in women who have had breast cancer and treatment. And this, I think, would be a huge improvement on women who suffer from a lot of the side effects of estrogen deficiency. Women who have breast cancer treatment are on anti-estrogens, and they have worse symptoms of the menopause, including hot flashes, night sweats, vaginal dryness, also difficulty sleeping, poor sleep, insomnia, vaginal dryness, pain with sexual activity, also pain in the pelvis and their joints, all from decreased estrogen. And in these women who are not candidates for estrogen, they're candidates for testosterone in these studies, and they can relieve a lot of the symptoms. Here at Atlantic Urogynecology, we're offering bioidentical hormone therapy for the treatment of menopausal symptoms. A lot of women suffer needlessly from hot flashes, night sweats, vaginal dryness, decreased sex drive, pain with sexual activity. And we have been offering bioidentical hormone therapy for over 2 years now, and it has been very effective in relieving these symptoms. So if this is something that you're interested in, call the office so that we can help you.